Dear listeners, welcome to Faces of Digital Health, a podcast about digital health and how healthcare systems adopt technologies. I am your host, Tjasa Zajc, and this is the last episode in a short series about digital health in Asia. In the first episode, you got a global overview of the region with Julian de Celeberry from Gallant Growth Asia.
In Q1 of 2019, Asia-Pacific Digital Health raised more funding than the US. And that's despite the current geopolitical differences between the US and China. That's a report we release every 6 months. We tend to always focus on those countries such as India and China, largely because they are the gorillas in the room. And then, of course, we focus on the markets that have substantial share of the ecosystem. Singapore being a case in point, whereby because of the nature of Singapore as a trading nation, as a geopolitical, should I say, center of Southeast Asia and various other attributes, it attracts an awful lot of ventures. With regard to the other markets, we do track them very carefully. To refer one of the countries you spoke about, Vietnam, at this stage is certainly a fast-moving, burgeoning, roughly speaking, has 1 to 2% ecosystem share. Vietnam, I would suggest, based on the data we have, has an emphasis on more patient journey type innovation. Southeast Asia, or should I suggest Asia, excluding Japan, Korea, China, India, Australia, is certainly in the last 12 months seen a very strong growth, both in terms of birth of innovation, but also in terms of a focus from investors and from multinationals such as, say, big pharmaceutical companies.
The second episode presented China with Julie Wang.
I think Chinese entrepreneurs in the digital health space are more open to working with governments, and they have more sophisticated strategy of how they actually work with the governments and navigate the difficulties and complexity in the healthcare system. I think that's one of the things the Western entrepreneurs could potentially learn and don't, from a mindset level, don't avoid working with the government when they think about their strategy and their go-to-market plan.
The third episode, India, with Sunil Anand and Kartik Dar from Project Echo.
India, I think, has taken the lead at a global level when it comes to digitizing and taking everything from a platform perspective. The first implementation of this was the Aadhaar project, which was the national identity project, where we have 1.3 billion Indians who have a digital identity. And this is, of course, an identity which can be reused across various other applications. I think that when it comes to healthcare, a similar approach definitely is possible. And the central government think tank unveiled a blueprint which is called the National Health Stack, which is a very ambitious plan for creating interoperability standards and data sharing across various entities in the ecosystem. That includes electronic health records, that includes health analytics, and the coverage and claims platform that is the part of the Modi Care umbrella as well as Echo, which we are looking to plug in as part of a platform for upskilling of these health practitioners.
And the previous episode about Singapore was presented by Tony Estrella.
Singapore is held in very high regards as a country that epitomizes the best of healthcare and where it can go. And I think, like many things in Singapore, there's a large part of that's a designed component, meaning that the government was very active in thinking through how to create the right system and infrastructure to help its citizens really elevate amongst other countries globally.
Today, you will be listening about the development in South Korea. South Korea is famous for many things. Worldwide, the Republic of Korea has by far the highest robot density in the manufacturing industry. Korea is the third largest market for virtual currency behind the United States and Japan. The country is also called the plastic surgery capital because of the cultural beauty obsession. According to a recent Gallup poll, 1 in 3 South Korean women have undergone cosmetic surgery between the ages of 19 and 29. Beauty trends are dictated by the K-pop industry. and South Korean government is even trying to limit stars' presence on television because the stars look too much alike. In the healthcare sense, South Korea managed to pull off what many other countries crave for, a substantial healthcare reform. The reform took place in early 2000s, and healthcare is financed through national health insurance covering the entire population. From the digital perspective, to establish big data in the medical field, the nation is currently gathering the medical records of about 50 million people from 39 hospitals nationwide by 2020. Despite all the technological progress, surprisingly, telemedicine is illegal in South Korea. You will hear why from today's speaker, Ogan Gurel, a doctor, professor, entrepreneur who has been living in South Korea for the last 9 years. His teaching experience includes cellular and molecular biology, neuroanatomy, bioinformatics, mathematical modeling and technology marketing at Columbia, Roosevelt, Harvard, and currently Digist. And he has also served as an independent consultant to several medical device firms in which he was specifically involved with both European and FDA clinical trial development and oversight. Enjoy the discussion, but just before that, a quick announcement. Faces of Digital Health has a new official website. You can browse through the archive of the episodes, read blog posts accompanying each episode, and find more information about the show at www.facesofdigitalhealth.com. As you can read on the website, your support is the fuel for the show. So if you enjoy the content, do leave a rating or a review in iTunes. It really makes a difference, especially since listeners can only see reviews from their own country. So any comment helps more listeners discover the show. Thank you for your support. I highly appreciate it. After all, this series about Asia came to life because half a year ago, a listener asked if I plan on covering Asia more broadly. So now, let's go to South Korea. Ogan, is it true that you're fluent in French, Turkish, and German and have conversational ability in Russian?
Well, yes, I worked in France and Germany and was originally born in Turkey, so I have some facility with those languages. Actually, I'm forgetting them a little bit, I should say, because I've learned a lot of Korean since being in Korea for about 9 years. So my Korean is actually quite good, but I do try to practice my French and German and Turkish and so forth because I enjoy learning languages and always meet different people and travel a lot.
How did you learn all these languages? How did you travel from one country to the other? You were born in Turkey, but you got a medical degree in the US. So how did you end up in South Korea in the end?
I think the best way, of course, to learn a language is to be in that country or where people speak a lot. I always made it a point when I was working. I worked in France at the Institut Lau Langevin in Grenoble between college and medical school, and collaborated with the group there quite frequently. And then I did some clinical trial and consulting work in Germany. Of course, I traveled to Turkey to see family, and now here in Korea. And in all of those circumstances, I tried to learn as much as possible the languages, both obviously talking with people, but I take the opportunity to study a little bit as well, so it would synergize with my immersion experience. And in fact, what was interesting is when I went to France after my college, as I said, between college and medical school, I was actually quite embarrassed that my French was not so good, having taken high school French, and it was not one of my best subjects. I was much better at science and math and so forth. But sometimes your weakness, you turn into a strength because I focused quite a bit on it, recognizing that it was not necessarily so easy. So ever since then, which was quite a while ago, I've always tried to be actually quite diligent in recognition of the fact that I'm actually not so good at languages. It forces me to spend time and focus. So that's how I've learned a lot of languages. In terms of coming to Korea, that was 9 years ago, and I was recruited by Samsung, specifically the Samsung Advanced Institute of Technology, which is their central corporate research lab, and within which is the CTO office for Samsung Electronics. And it was in that capacity, technology strategy, particularly around healthcare, that I joined Samsung. That was their motivation because they were going into healthcare, but I had my own motivation to join Samsung because my research interest ever since college has been in the area related to bioelectronics. And to the extent that Samsung was going into healthcare, potentially very disruptive in the field with new approaches, and the bioelectronics, specifically terahertz medicine that I'm very interested in, I thought that would be a good fit for my own professional and personal goals.
Where was digital health thinking in South Korea and at Samsung when you were there? That was between 2012 and 2015. Quite a lot has changed by today on a global scale.
Samsung actually originally, when I first joined 9 years ago, Samsung Electronics, the healthcare mandate was quite broad and was not just digital healthcare. I mean, obviously Samsung is famous for making chips, semiconductor chips and mobile phones and so forth. But what we were doing was looking at quite a wide variety of technologies, all the way from high throughput DNA sequencing, microRNAs, surgical robotics, fairly advanced imaging techniques, and so forth, in addition to digital healthcare, which was not that big a part of it. That being said, things evolved at Samsung Electronics, so that very broad and aggressive healthcare focus was quite circumscribed and pulled back after changes in the leadership. And now the digital healthcare, I think, would be fairly more limited. I mean, some may argue with that, but it's basically focused more on the wellness side and trying to get as much synergy as possible with the mobile business and smartphones and so forth, as opposed to completely forging two new areas and new paths, particularly in the more medically oriented therapeutic and diagnostic side.
In 2018, for MENA FN, you talked about the so-called Korean gravity, which you said is an obstacle to faster breakthrough of solutions globally.
Well, first of all, I should say it's a generalization. There are always exceptions, but this concept of Korean gravity is related to things. One is the ambitions and sort of goals of individuals and companies in Korea are typically quite ambitious. It's very admirable here that they're always aiming for, first class, world class, being very global, very top ambitions. The challenge is that sometimes when these are implemented, so to be global first class, you actually have to be totally different and forge a new path and not just follow a fairly defined program. That gets very discouraging or tricky. Or if you want to be very global, you actually have to work with quite a bit of foreigners and do a lot of travel and engage outside your comfort zone. And then that becomes very tricky as well. So what I found is sometimes a mismatch between the ambitions, and then at some point people and institutions revert to their comfort zone and don't enact those ambitions. So I call that the Korean gravity. I mean, it's not specific to Korea, but I think I've seen it quite a bit here.
Does this mean that the companies are more focused on the home market? Because, for example, South Korea caught the attention of the global digital health community last year with the announcement that 25 miles out of Seoul, the capital of South Korea, a futuristic hospital with hologram visitors, indoor navigation, facial recognition security, and so on, is supposed to open its door next year.
Yeah, I haven't heard about it. I wouldn't be surprised if there were a lot of announcements and ultimately nothing happened or very little happened. That being said, quite a few miraculous things have occurred in Korea. It's a tremendous progress and so forth. So I don't mean to kind of discount that. I think that in certain ways, this Korean gravity, in a way, also reflects the downside of the success. In other words, Korea is quite advanced and developed, and to some extent, these ambitions to be global and to be, really great, which was absolutely imperative during the development drive in the 1970s and 80s when Korea was, quite poor actually. There's no gravity because people were quite, at a much lower level. But now I see a certain complacency and, you don't actually have to do all that to be moderately successful. But I think that that's actually mistaken. Global competition continues, even if you're at a high level, and perhaps it's even more intense. So I think that Korean gravity can be an important challenge. Now, what's also interesting is the Korean economy per se, which I believe is the 11th largest in the world, is actually big enough to support with reasonable success a domestic market. And that's actually, in a sense, a negative thing because startups can be moderately successful just addressing the local domestic market. If you contrast that with Singapore, for example, or some other fairly active countries, Latvia, or even Sweden and so forth, that doing a lot of innovation, if they focus on their local market, they will categorically not be successful. I mean, a Singaporean startup in digital healthcare that's aiming for the Singapore market, obviously can start with that. But if that's their ambition and their goal, they will never truly be successful and certainly not be a unicorn or anything of that sort. Korea is tricky because the market is big enough to kind of be okay. But if you only address the Korean market, you will not really be successful. You'll not necessarily be globally competitive, and you're certainly not going to be a unicorn. So that's part of the challenge, is that some of the entrepreneurs and other leaders, they may have these wider ambitions, and then they say, well, maybe I'll just stick with Korean market. It's good enough.
Can you think of any examples that illustrate the front runners or the most successful solutions, for example, in the personalized medicine spectrum? So because South Korea has a culture of early technology adoption and combined with the country's strong computing infrastructure and biological research strengths, the country is supposed to be an obvious personalized medicine test bed.
They may not always be the earliest to develop the technologies, but certainly Korea is a great place as a market to test as well as build out, new technologies. And I would encourage global companies to consider Korea as that kind of a test bed. And obviously in some areas, Korea is also first and leading the way, 5G and things like that. Personalized medicine, I think that is, to be very honest, not really implemented across the board, not necessarily in Korea, but anywhere, quite frankly. I mean, there are examples in specific areas, particularly around cancer, breast cancer, and so forth, where there are elements of personalization related to genetic profiles and so forth. And so there are these pockets of personalization. As far as broad, sustainable initiatives here in Korea or around the world, for that matter, I think we're still waiting, for that. That being said, Korea does have infrastructure, as you also mentioned, and a lot of hospital processes that are quite advanced. I think Korea, in particular, for example, the Seoul National University Bundang Hospital, SNUBH, has some of the world's best EMR, electronic medical records. And I wouldn't call that personalized medicine, explicitly so, but they have the framework to do a lot of that. And in isolated areas, as I mentioned, they are doing that. A work in progress, I should say.
What's so specific about this EMR that you mentioned? Does it have, for example, structured data, which could be a good base for artificial intelligence algorithms development?
It's very good because it has a great user interface. It has a wide variety of data that's captured. It's certainly amenable to AI analysis. I've seen it in action. I know that they are working on global solutions, not just Korea. Again, hopefully the Korean gravity effect will not prevail, but it's a very impressive system. I think it's well primed for some of this personalization and AI in terms of the data that it collects and the user interface that it has, and all the different functions.
It's interesting to me that you mentioned the importance of the user interface because in terms of arguments regarding the importance of healthcare IT design, I thought that the sentence by one of the NHS functions was usability is a clinical safety issue. So I thought that this sentence so well defines how important it is how doctors use the system. And you are an MD yourself.
Yeah, that's exactly right. As I think I mentioned earlier, I taught at Sungkyunkwan Kwan University, Samsung Advanced Institute of Health Sciences and Technology, and I taught a mini MD course, and I do that around the world as well. There's a next version of the course is being offered next week in Singapore. And this mini MD is a comprehensive overview of all of medicine for non-doctors. And my philosophy of that is whether it's biomedical scientists or IT engineers, they really need to know how doctors think and how medicine works to implement their solutions. And I think particularly in the IT industry and a lot of the American EMR systems had a big disconnect between how the IT world works and how the medical doctors work. And so that has inhibited usability, impaired usability. In fact, as you know, the EMR penetration, electronic medical record usage rate in the United States, despite billions of dollars, perhaps hundreds of billions of dollars at this point, has been less than anticipated. And in fact, many people will call it disappointing. I don't know the exact statistic, but I think it would be less than, maybe around 50%. Whereas here, as I mentioned, at Seoul Bundang National Hospital, Seoul National University Bundang Hospital is basically 100%. And I would say throughout Korea, we're talking about above 95% utilization.
Since you mentioned the United States, so what's your comparison of the U.S. healthcare system and the Korean healthcare system and your personal experiences, perhaps?
Well, I have experienced professionally as well as personally as a patient, and I think that the American healthcare system is actually completely different kind of system from most any other system in the world. So that's in a category by itself. The American healthcare system there are a lot of good people there, and I have a lot of friends who are practicing doctors, and lots of people trying to improve the system, but it's quite dysfunctional. People have been saying for years it's not sustainable, whether it's at the cost rate or the medical errors or the complexity and the outcomes being less than hoped and so forth. It's not sustainable. Of course, people have said that 10 years ago and 20 years ago, and somehow the system still struggles along, but it's completely in a different category. Korean healthcare system is what we would call a national health insurance and a private provision of care. So it's not like the UK NHS, which is both national insurance as well as national care. It's a mixed model. And I think the Korean healthcare system is one of the best in the world. It is very efficient, and I think access is actually quite incredible, apart from perhaps very far rural areas. Korea is not such a big country, of course, but it's still spread out. It's amazing how easy access to healthcare is. I mean, you have a problem, you go to your internal medicine doctors every few blocks. You don't have to go to the emergency room. You don't have to go to an academic medical center. Access to healthcare, which I think is very important, is quite easy in Korea. If you have access to healthcare, that makes the cost go up. But if you can catch problems early and access healthcare on a preventative basis, or at least early diagnosis basis, you will save a lot of costs. You contrast that with the United States. If you want to see a primary care doctor, you basically have to schedule an appointment, and I'm just guessing, but most people will probably not be able to get an appointment earlier than 3 months for a primary care doctor. If they want to see the obstetrician gynecologist, maybe 4 or 5 months. So guess what? You go to the emergency room, and it's not, medical doctors know that that's not the best type of practice, but access to care is actually quite difficult in the United States.
While you were still living in the US, you went on an interesting journey. You basically walked between two cities to get an on-the-ground perspective of the healthcare system.
This was in 2009, around when the whole Obamacare was being debated. I remember President Obama at that time was saying that he was getting the opinion of experts, which were basically health insurance executives, pharmaceutical executives, health policy experts, and all these experts. And it was very strange to me because as a doctor, we learned that the patient is foremost. And there's a phrase attributable to Sir William Osler, a famous physician from the 100 years ago. Listen to your patient; they are telling you the diagnosis. So we're always, as doctors, trained to think about, obviously the patient. And so the fact that, ordinary people were not being engaged in this discussion, and Obama actually later implemented some town halls, and there were some discussions related to that. But at least in the early stages, it seemed he was focusing on, quote unquote, the healthcare experts. And I guess I was, in that category, but I still thought that was insufficient. I wanted to get more what I would call the voice of the people. So I walked from Chicago to Washington, D.C. I was living in Chicago at that time. It's about 700 miles, 1,000 kilometers. It took me about a month. And during the day when I was walking, I would just be talking with people, getting their stories and documenting them. And then I would stay at a hotel and arrange for the luggage to be sent to the next hotel. And there were some colleagues in Chicago organizing all of these logistics. So I focused on the walking and getting those opinions. And eventually when I reached Washington, D.C., met with several lawmakers, including Dennis Kucinich, who was a leading proponent of the public option and single-payer healthcare at that time. So he was quite attracted to these stories, and he ended up publishing them in the Congressional Record. So they are memorialized there and were shared with essentially the public. Obviously, I got consent for these stories, and some of them they gave consent for the pictures, some, just for the stories. Some were anonymous, and so on and so forth. So I got all these stories as the voice of the people. What's interesting is I myself did not propound a particular opinion about which way the debate should go. I was trying to serve more as a vehicle for collecting and transmitting these stories, which I thought was very important, in fact, central to any kind of healthcare reform debate.
Even though some media caught your project and tried to ask you about your findings and about your opinion, they quickly lost their interest because exactly what you said, you didn't form a specific opinion, you didn't take sides.
Well, that's very interesting because this was in 2009. And as I walked, on the ground, as it were, I got a sense of the interesting changes in the media and its connection to the polarization of politics in the United States. Now, in 2009, things were getting quite polarized, but we didn't have the kind of circus that you sometimes see nowadays that's going on, where the opinions of those who are most sort of crazy or most loud or most entertaining become a lot more, listened to. And this was a little bit of a generalization, but I almost got the sense that unless I kind of, made a kind of show of my own opinions and started to really give some aggressive opinion on one side of the fence, then it wasn't so interesting. But if I got there and I started to spout on about all sorts of crazy theories or, just act weird or wild or whatever, I think the entertainment value would have been greater and I think I would have garnered, more attention. But as I said, I was trying to be quite neutral and instead just collect and transmit these stories of people. And that just seemed a little less of interest to the media at large. I mean, again, I'm generalizing. There's some exceptions to that, but I thought that was an interesting trend. And I said to myself at that time, if that's the case, I think we're going to see more polarization and, more compromise of news quality because it becomes influenced by the entertainment value of what's being interviewed.
How did the whole project affect you in the end?
I was obviously medically trained. I was a professional healthcare consultant at quite high levels. I had worked at Booz Allen Hamilton, and then I was medical director and vice president at ST2, which was a leading healthcare consultancy, which is a leading healthcare consultancy in the United States. Traveled all around the United States and did a lot of work with academic medical centers. And my training was at the Harvard Medical School, Mass General Hospital. So I did have a lot of experience, but to actually walk around and talk to everyday people and not necessarily in the academic medical center setting and not, talking to hospital leadership, was quite illuminating. So a couple things that I learned, I had originally thought I'd talked to quite a few uninsured people and hear their, very sad stories and so forth. But actually, I ended up talking to quite a few people who did have some form of insurance, and they had quite a bit of hardship, even though they had insurance. And so that was actually quite surprising to me. Actually, it wasn't exactly surprising because I had insurance when I was in America, and it was often strange. They would reimburse, they wouldn't reimburse. You'd have to get into arguments. You'd have to submit papers, and, it was just a big mess. So I certainly was not entirely surprised, but the extent to which the system was dysfunctional, even for those who are insured, was quite profoundly disturbing. The second thing I learned is that people really wanted some sort of change, and I think that the political response was quite incremental. I mean, Obamacare is actually not such a big change compared to other systems around the world, and what happened in Korea in terms of the changes that allowed them to achieve their system now. I actually think a more radical approach would have been better. But again, I declined to really present my opinions, but that was what I learned.
In the early 2000s, South Korea introduced two major health reforms. So one was the merger of insurance societies into a single insurer system, and then there was the separation of medicine prescribing and dispensing. And as you mentioned before, healthcare is financed through the national health insurance covering the entire population. But one thing that I did find was that despite universal coverage of the population, the financial protection and high out-of-pocket payments remain a key policy issue. Is that true?
First of all, I want to confirm, in the early 2000s, there were those two major pieces of legislation. I should put a little bit of context. Obamacare basically mandated for larger companies and certain institutions healthcare insurance, as well as for some individuals, most individuals. And that was actually part of the South Korean process early on, I believe even starting early in the 1960s or 70s. And then there were these private insurance companies, and as you said, the merger into national health insurance. So the reason I say that is Obamacare was a kind of very early step that Korea had embarked upon in the 1970s, culminating with the early 2000s, as you said, where they effectively nationalized the insurance system, but kept the rest private. To your point about out-of-pocket costs, so the way it's mostly structured is essentially 80-20. You pay 20% of the bill, and the insurance pays 80%. So there is some out-of-pocket costs. Generally, it is quite reasonable. I would imagine if you're, in a very poor income bracket or no income, it would be onerous. But we're talking about, for an internal medicine appointment, about $3.50 co-payment. And you fill prescriptions, and they typically are, for basic antibiotics or fairly routine cardiac drugs. They would be also in the $5 range, month supply and so forth. Those can go up for more complex things. But in general, a lot of healthcare, even in the specialty level, you go to an eye doctor for eye exam. We're talking, again, $5 copay. If you contrast that to the United States, where you have some high deductible plans, you pay $3,000, $5,000 before there's any insurance kicking in. And the insurance kicks in, you still have copays. So I think it's quite reasonable, unless you're in a very poor income bracket, that the copays are not that onerous. I mean, it's not entirely free insurance or free healthcare, which I actually think is reasonable to expect. The consumer, the patient should have some, sort of part of this. I should say also that some of those copays, or most of the copays, become tax deductible. So there is some relief in that regard, but I don't think they're unreasonable. Of course, there will be some percentage that will be a challenge, and perhaps politically some people want it to be completely free, but I think they strike a fairly good balance.
Since you've been living in Korea for the last 9 years, I am really curious to learn more about how do you perceive the culture. One of the things that South Korea is famous for is that it's a beauty-obsessed country, and according to a recent Gallup poll, 1 in 3 South Korean women have undergone cosmetic surgery in the ages between 19 and 29. Also, the South Korean government is trying to limit the presence of the Korean pop stars on televisions because the stars look so much alike. Do you see any of this translating in the way people take care of their health? What's your overview of the culture and your experience?
They have said that Seoul is the plastic surgery capital of the world. I think those phenomena that you mentioned are largely true. I think it's a fairly healthy, conscious society. I mean, you'll see a lot of people walking. There's a lot of parks. They have exercise machines. There's a active biking culture, active hiking, trails culture. Obesity rates are not that high, although it's increasing. There's a high degree of smoking and some extent binge drinking, although that has reduced a little bit, I think, from times of the salarymen, getting drunk when they're meetings and evening meetings and so forth. By and large, it's a pretty health conscious culture, and of course that intersects to some extent with beauty or how people look. I do think it's quite extreme. Many cases where there is a uniform ideal of beauty puts a lot of psychological pressure. And some people want to look all the same. And of course, that in the end, to some extent, is not that beautiful. There is certainly a beauty to be appreciated in diversity. So it's a little bit ironic, but that sort of very common ideal ends up, compromising what was the original goal. It's hard for me to comment. I don't have any policy recommendations. I can't comment on, what the government is doing relative to K-pop and so forth, but it's certainly a big phenomenon here.
Worldwide, the Republic of Korea has by far the highest robot density in the manufacturing industry, a position the country has held since 2010. Does this translate in any way to digital health or elderly care development? Are robots in healthcare as common as they are in Japan, for example?
That's correct. In terms of industrial robots, Korea has the highest density. At least that's what I've heard, which you also mentioned. I think robots in healthcare are a little bit less prevalent. I'm not intimately familiar with the case in Japan, but I still think that's an early area. I work actually for a company called Field Robot Technology. I'm their chief scientific officer, and we're developing a healthcare robot along 2 dimensions. One is care assist, essentially helping nurses or patient care assistants to lift patients, especially in America or other countries where obesity rates are very high and lots of aged patients, and you have less younger people taking care of them. So those sorts of support is very important. And then the second category is mobility assist, is for elderly, disabled, or otherwise mobility challenged people using an exoskeleton wearable robot to help walk around. So care assist, again, exoskeleton wearable robot to help lift patients, and then mobility assist for the elderly and disabled to improve their mobility. So we're working on that, and there's interest both from industry as well as hospitals and individuals, but it's still early and a work in progress. Korea is very advanced in terms of infrastructure. A lot of people have talked about 5G, and ironically, Korea is fairly less advanced in the area of telemedicine. And the reason is twofold. One is, as I mentioned earlier in the discussion, access to healthcare is very easy in Korea. To get on a telemedicine and talk to a doctor from your home with the webcam or whatever, as opposed to just going down the street to see them, and you don't need an appointment, you just show up, and generally you're seen within 20 minutes, maybe less than an hour. It depends. If you show up on Monday morning, you can expect to wait longer. If you show up on a Wednesday afternoon, you might immediately see the doctor. Obviously, it depends. But the point is, you don't need to have a telemedicine solution as compared to, say, in the United States or in very geographically dispersed areas, Australia, Indonesia, Africa, and so forth. But Korea the value proposition, if you will, for telemedicine is not as strong. The second reason telemedicine is not widespread in Korea is it's in fact illegal. And there's a concern among the neighborhood doctors that if there's telemedicine, the patients will then connect to all the academic medical centers, which are obviously, fewer and harder to get to, not impossible, but still it's not like around the corner from your home. So there's a concern that everyone will just use Seoul National University Hospital or any other of the well-known academic medical centers, and that the local doctors will suffer because of that. So that doctor lobby and other reasons as well, as I mentioned, have effectively made telemedicine not certified or essentially illegal to dispense medical advice over the internet that way in Korea. But as I said, it's not as necessary. So even if it was implemented and there's this fear of the local doctors of everyone going to the academic medical centers, I still think, it's not as much of a value proposition as other countries.
It's probably hard to expect that the political climate would change in order to support telemedicine.
I don't think that there's any really strong force pushing for it right now. Now, that being said, I think, as I said, Koreans have quite advanced technologies in this area. So if they are global and they bring some of those solutions globally, then I think they could be successful. So the irony is if they focus on the Korean market, that's clearly a dead end for them in this area of telemedicine. And the same is true for other companies from outside who want to get into Korea and they think, well, it's high tech, let me do telemedicine or something to support telemedicine. It's not going to be obviously a very promising strategy.
What about blockchain in healthcare? South Korea remains the third largest market for virtual currency behind the United States and Japan, and a total of $6.8 billion in cryptocurrencies changed hands in January, according to the data provided by Messari.
I think those statements are correct, and there are, a diversity of companies involved in medical blockchain. I think that to the extent that those blockchain companies are connected to cryptocurrencies, and there was a substantial crash in those markets all of last year, affected quite a few of them. I think that there has been some stalling of progress in that area. It's still very early, and I think things were ramping up, but progress has significantly stalled.
Just to wrap up, what would you say other countries around the world can learn from South Korea in terms of digital health development?
Two things. They should study the actual healthcare system. I think that that's been, very successful. I would also encourage them to look at, one hospital in particular, Seoul National University, Bundang Hospital. They have implemented a lot of processes. That's one that the EMR, as I mentioned, and some digital healthcare, as I said, they're not doing telemedicine because that's not legal. But I would encourage them to look at that, and I'm happy to, facilitate that if that's of interest.
This was the last part of a short series about digital health in Asia. Coming up soon, a series about artificial intelligence in healthcare. Stay tuned. Visit the website www.facesofdigitalhealth.com and stay informed about the global development of digital health.